Good evening, my name is Paul Baccanello. I'm a physiotherapist here at the Wakefield Sports Clinic here in Adelaide. I've been asked to present as part of the month of health and wellbeing for doctors in training on exercise and the benefits that it can have for your health and wellbeing, both psychologically and physically. I'd like to thank the AMA for asking us to participate in what we think is a fantastic initiative for doctors in training. As doctors in training, it's very well known that you're all committed to providing the highest quality of care to your patients. In order to do this, that comes at a cost. It's well known within the health community that doctors place great demands upon themselves in both clinical and unstructured settings. Many of you probably committing over 70 hours per week doing so. And this presents a problem, as given you've got these enormously busy schedules, there's not much time in the day left for anything else, particularly exercise. I've had a bit of a read on your website prior to presenting tonight, and I've noticed that some of the problems encountered by young doctors include mental health issues such as anxiety and depression. But there's also many other conditions, particularly musculoskeletal conditions, that I treat doctors for on a regular basis in my clinic, that they suffer as a direct result of their profession. You may already be aware of the high quality evidence highlighting the benefits of physical activity for both physical and psychological well-being. You've probably read the American College of Sports Medicine that's telling us that we should participate in a minimum of 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic exercise every week. And in Australia, we have the Department of Health, we have Sport Australia that are also promoting the same message through initiatives such as the Move at 30 or Find Your 30. And what they're all really telling us, and this is a really key message for doctors in training, is that you really must participate in a minimum of 5 30-minute sessions of moderate intensity activity per week. This can be done as 5 sets of 30 minutes, 5 days a week. However, it can be done perhaps as 3 25 minutes more vigorous activity exercise. It really can be any combination as long as you achieve the acquired amount of time, the 150 minutes or the 75 minutes of more vigorous activity at the appropriate intensity. As doctors with very busy lives, I imagine you're watching this video thinking, Paul, how on earth am I going to fit this 150 minutes into my week that's already chockers? Well, what I want to try and help you with today are some strategies that you can use to try and fit in those 150 minutes. First strategy is just to remember that physical activity isn't just about organised sport or going to the gym. If you love organised sport, have time for organised sport, and that's a really nice way for you to get your 150 minutes a week, and same with the gym, fantastic. But some of you will just simply not have the time. So I'd just like to let you know that there's other physically demanding activities that you can use to get your 150 minutes. Things simple as washing the car, cleaning or vacuuming the house, taking the dog for a brisk walk, riding to work. I'm someone who rides 20 minutes to work, 20 minutes home, and that's how I tick off my 30 to 40 minutes a day. The other thing as well is if you've got a smartwatch, only 7,900 steps a day, 7 days a week is going to cover the amount of exercise that you need to do or physical activity that it's recommended that you do. The key is simply to try and get your heart rate up during the activities that you might do. So there's a few things you can do to maximise your chance of doing these activities on a more regular basis. Try and make it convenient. Don't go to the gym that's 30 minutes away. Go to the one that's just around the corner. Or if you've got an oval, perhaps there's some exercises at an oval just down the road that you can use and do a little bit of running or some skipping or whatever it might be. You can exercise on your way to work, as I said that I do. Be creative as well. In large hospitals, you can find your ways to get your heart rate up by briskly walking the corridors. And the message that you would have seen in many of the hospitals is, and it really is important and simple, is that taking the stairs instead of the lift. Try to make exercise part of your daily routine. It's also important that exercise is comfortable. If it's too strenuous and it's too hard and you're working really hard and you're totally exhausted afterwards, you're really unlikely to do it on a regular basis. So I would encourage you to do it comfortably, get your heart rate up, but it doesn't need to kill you either. The thing to remember though is that the higher intensity exercise that you do is going to be of greater benefit. But understand that if you don't go too hard, but you are doing you're lifting your heart rate during the activities, that you're doing okay. It's also important to make it enjoyable. So if you like tennis, don't play cricket. If you're a clean freak, become an elite vacuumer or a mopper. If you're like me and you're reluctant to do domestic duties, do them quickly. It'll get your heart rate up, the clinic will take less time, and you'll come home to a sparklingly clean kitchen, dining room and bedroom. If you're a car lover, take your car to the car wash where you have to clean it yourself, rather than taking it to the automatic car wash. There's all sorts of creative ways that you can find to tick off your 150 minutes per week. This month, I'd really encourage you to come up with a few ideas and try a few different things so that you can find ways to conveniently and effectively get you 150 minutes a week. The other thing is also the accountability. There's really nice ways, as you will all know, with the Garmin, the smartwatches, your smartphones, just to keep track of your activity and also send yourself reminders. It's a really nice way to keep yourself accountable to make sure that you're getting the right amount of activity. The one take-home point that's really important with all your exercise is just to make sure that you start slowly when you first start and gradually increase what you do. Don't go the boom and bust where you go all of a sudden you go hell for leather and then all of a sudden a week later you're injured and you can't do any activity. So really important to start slowly. Not only is physical activity important to the well-being of your doctors, it's also very important broadly to us all. With obesity rates on the rise, sedentary lifestyles becoming the norm, it is critical that we have a plan to change the culture of physical activity in our lives and in those of our patients. I really believe that if we don't do this, and it's been mentioned many times before, that the health and well-being of Australians is sure to deteriorate. Physical inactivity was the fourth leading risk factor of all deaths, according to the Australian Institute of Health and Welfare. This same body of research suggests that over half of Australians don't meet the minimum physical activity requirements. But significantly, in most health settings, and this goes for physios as well, is that the findings are that physical activity of patients isn't routinely assessed. 9 in 10 people are going to visit their GP this year. The evidence tells us that patients are very responsive to advice provided by their GP, including in regards to their physical activity. So as first contact practitioners, you're perfectly placed to make a significant impact upon the health of the members of our community. As health practitioners, we need to lead by example. If we model a lifestyle that manages to incorporate physical activity, the evidence tells us that we're more likely to see that behaviour in our patients. So as you consider this month the benefits of exercise for yourselves, I'll also encourage you to take note as to how this will have a direct impact on those you have trained so hard to help and to assist. Perhaps this will provide that little bit of extra motivation that you need when you're reluctant to take the stairs. We're very fortunate in this country that we have access to some of the best evidence around, and this is no different with exercise medicine, which is underpinned by an excellent evidence base. If you can find the time, I'd encourage you to visit a website called TREC, which is Translating Research and Evidence Knowledge. It's a website that was set up by Dr. Christian Barton as part of the La Trobe University in Melbourne. And it's a fantastic resource for simple and effective exercise prescription that's simple and evidence-based. So this evening, I haven't really got the time to go through it all, but we have fantastic simple resources online that I encourage you to have a look at so that you can not only prescribe evidence-based exercise to yourselves, but also just as importantly to your patients. In closing, we know that health and well-being is intertwined with your levels of physical activity. During this month dedicated to the health and well-being of doctors in training, I encourage you all to find a way to find your 30. Thanks for listening and all the best.